Be recording now. So I have this question and answer session set up today to go over a new funding opportunity that is available from IHCDA. This is for domestic violence coordinated entry funding. So just a quick agenda for today. I'll give an overview of the funding, go through some of the funding requirements, talk about the applicants that are eligible to apply for this funding, what those eligible project types look like, how you can apply, the timeline, and then I'll be sure to leave some time at the end for questions. So jumping right in, first I want to talk about the funding structure. So this is funding that comes from the United States Department of Housing and Urban Development, or HUD. So they are the funder, and IHCDA applies for funding from HUD each year in an annual competition. So IHCDA is the direct recipient of this funding, and then this year we are making available several subawards under this. So this would go out to subrecipients. There are also a few other things under the award that IHCDA gets that you don't necessarily see reflected here. There's also some money that goes to contractors and some that goes to IHCDA admin. But where the applicants for this award would fall if you're awarded would be these subawards. I also want to quickly touch on what regions are, just in case anybody on the call isn't familiar with those. IHCDA oversees the balance of state, which is 91 of the 92 counties in Indiana, excluding Marion County. So those counties are grouped into different regions. There is a coordinated entry lead agency in each one of those regions. And you can see on this graphic what counties are included in which region. So when I talk about regions, this is what I am referring to. Okay, and then to go over just a quick summary of the funding opportunity that's available. This is Continuum of Care funding. This will be a supportive services only award. So if we have people on the call that receive other Continuum of Care funding, you might already have an idea of what this is. Typically, there are other typically other budget line items in your COC award. This would be specifically for supportive services. So this award would not be for providing actual housing. This would be specifically those services. Each award that will be available would be up to $30,000. You do not have to apply for the entire $30,000. You can do less than that, but the awards will be capped at $30,000 each. Funding under this award would have to be used to serve those that are experiencing Category 4 homelessness as defined by HUD. And that is quite different from Category 1 homelessness, which is what a lot of other COC funded agencies focus on. So I will go into a little bit more detail about what exactly Category 4 homelessness is. For this funding, projects will have to work on building the relationship between DV and non-DV service providers that are in the region. So the regions being what I showed on the last slide, we really want to see kind of a partnership built between both the domestic violence service providers and non-domestic violence-based service providers. Projects that we fund must reduce barriers projects that we fund must reduce barriers to accessing the coordinated entry system for survivors and or decrease their housing wait times. And the award term for this funding will be May 1st to November 30th of this year. COC funding is typically 1 year, but this would be a shortened award term. So this funding would just be 7 months instead of that full year. So if you are awarded the funding, you would have to get started kind of quickly implementing that since the award year does end on November 30th. And I really do want to emphasize that we will only be funding one project per region. So if you think somebody else in your region might apply, I would really encourage you to kind of get together with them or get together with the CE lead and discuss a strategy for applying together rather than trying to compete with other agencies that are in your region. The purpose of this funding is really to emphasize that connection being built up. So I would really encourage you to speak with others in your region before starting an application, just to make sure that everybody's on the same page and you can work together rather than competing. Okay, next, I'll talk about some of the funding requirements. So I mentioned this a little bit on the slide before, but I do want to go over the Category 4 definition. So Category 4 homelessness, as defined by HUD, looks very different than other forms of homelessness. I won't read this definition off the slide to you, but just to hit on the major points, somebody that is considered Category 4 homeless would be a survivor that is fleeing or attempting to flee domestic violence or another dangerous or life-threatening condition. They have no other residence and they lack the resources or support networks to obtain other permanent housing. So in practice, that looks very different from other types of homelessness. For instance, a survivor does not have to be literally homeless to meet the HUD definition. They could be staying with a friend or with family temporarily, but not have the means to stay there indefinitely or to find other housing on their own without some type of assistance, and they would be at risk of becoming homeless. This could also look like an abuser staying or survivors staying in their unit after an abuser has been removed for whatever reason, but they do not have the means to maintain that unit on their own, so they do have a risk of becoming homeless after the abuser has been removed. Or it could be a survivor that is still living in a unit with their abuser, but would like to flee, but they don't have the resources to do so. And if they were to do that without assistance, then they could become homeless. So Category 4 homeless looks very different than other types under the HUD definition. So I really do want to emphasize this since these are the clients that you would be serving with this funding. Next, the eligible cost under this award, it is a supportive services only award. So the only line items available to you under the budget would be the ones that are listed here. And again, I won't go through and read this list to you, but I do want to make note that included with this is also the direct provision of these services. So this includes things like the cost of labor, supplies, and materials that are necessary to provide the services. And if you do want to kind of learn more about what is available under each of these, I have the Code of Federal Regulations for these linked, if it will load. But on this website, you can go and look and see what all of the different component services are. And it gives you more information about what specific items are eligible under these different categories. And if you scroll up on this page, you'll also see that this is the CFR for the Continuum of Care program. So if there's anything else that you're curious about and you want to click through, there are links at the top. And on the presentation down here, I won't pull it up now, but I do have a link to the Cornell website that has the same CFR. It's formatted a little bit better than the other website that I pulled up. So if you are just looking at this one page and you want to read through some things, that might be a little bit easier to navigate through. The next thing that I want to talk about is match. So this is Continuum of Care funding, and that requires a 25% match for the project. Or another way to think about that is a 4-to-1 match. In practice, that looks like the funding that we would award would essentially be 80% of your budget, and then 20% of the funding would have to come from some other source. So for instance, if you apply for $8,000 under the award and you spend all of that, then you would have to provide $2,000 in match that comes from some other source. When looking at that as a total, the $2,000 is 25% of $8,000. But in total, your award budget that goes towards the project is $10,000. If that is a little bit too confusing, then just think of it as the 25% match, where you would, whatever you spend on the award, you would have to make sure that you're providing 25% of that by the end of the award period. I also want to point out that match is required for the amount for which you are actually reimbursed. So if you do have a budget that you don't end up spending all of, you would just have to provide match on what you are actually reimbursed for under the COC funding. Anything that is claimed as match would have to be spent on eligible costs and for eligible clients. So if you, for instance, if you operate a shelter and maybe serve a client that is a veteran and is not experiencing Category 4 homelessness, any services provided there would not be something that could be counted towards eligible match for this award. With this, project administrative cost can be used as match. They just are not available as a budget line item for your project budget. So I have another link to that same CFR page here, and then down here to the Cornell page, since it's a little bit easier to navigate. But you can use anything that is listed under project administration as match for your award to meet that 25% threshold. And then again, for this, staff and volunteer time can be used as match, as can any supplies that you use for delivering services to clients that are listed on that supportive services section. And then monitoring, if you are selected to receive this funding, you would be, there's a chance that you would be monitored in the future. With monitoring, this really, this slide really also brings up some of the funding requirements and things that you would have to make sure that you have in place. So with monitoring, we would be looking at things like documentation of cost eligibility. This would be both for anything that is submitted to IHCDA for reimbursement on your monthly claims, as well as anything that you claim for match. We would also be looking at the sources of match, any MOUs that you have in place, make sure that those are all correct and we have everything appropriate on file. We would also be looking at fiscal controls and accounting procedures, written policies and procedures that you have as an agency. And we would be looking to make sure that you use DB Client Track and you have the appropriate client files available. And anything related to this award, you would have to make sure that you keep on file and obtain access to that for 5 years. Next, applicant eligibility. Some of the basic requirements for receiving COC funding are listed here. So you would have to be a 501c3 not-for-profit agency. You do also need active Indiana Secretary of State registration. In the application packet, there is a link to where you can go to obtain a screenshot of this and submit it. You also need to have an active SAM.gov registration. Same thing in the application packet. There's a link to where you can find this. Along with the COC funding for the federal requirements, you have to have a homeless or formerly homeless member on your board. There is a form in the application packet that you can fill out to certify this. And if you are an applicant or the recipient of other IHCDA funds, so that could be other COC awards, HOPWA, ESG, anything from a real estate team or any other areas at IHCDA, you would also need to be in good standing for that funding to be considered for this. And if the applicant is a DV service provider, I'm sorry, the applicant would have to be a DV service provider, a coordinated entry lead agency, or a homeless service provider in order to be eligible to apply for this. So continuing with the requirements, to go into a little bit more depth on that last point that I talked about, the project must involve, at a minimum, a regional CE lead agency and a DV service provider. Standard homeless service providers can also apply for this funding, but they would have to include both of those agencies listed above as partners. And they are also able to be an additional partner to a CE lead or a DV service provider if they are the main applicant. So just to make sure that that is clear, I have a flow chart to kind of go through that. So if the DV service provider is the applicant, then they would be required to partner with the CE lead agency, and then optionally a homeless service provider or some other type of agency. With a CE lead agency being the main applicant, kind of the inverse is true. They would have to have the DV service provider as a required partner, and then an optional partner of homeless service provider or other. And then if the homeless service provider is the main applicant, then they would be required to have the DV service provider and CE lead agency as required partners, and then they could have another additional partner if they wanted to. And when I mention other additional other optional partners, that could be Maybe you have multiple DV service providers that want to be included in the administration of this project, or maybe you partner with a CE lead agency in a bordering region, or maybe you have multiple homeless service providers, or it could be something that is not listed on here and kind of an agency or an area that is external to this service typically. And for one of the project types that I'll talk about in a little bit, that is probably something that you would see for that one specifically. Now I'm going to jump into eligible projects. So for the project requirements, some of these I've already talked about, but I just really want to emphasize this since these are so important. The project must serve persons that are experiencing Category 4 homelessness. This COC award is funded under the DV bonus funding, so this funding must specifically be used to serve those Category 4 clients. The project must also attempt to decrease wait times for survivors to access housing and or remove barriers to accessing CE for survivors of domestic violence. And then lastly, I've had a couple of questions about this. So I do want to clarify something in the application. The applicant will have to work with IHCDA to document their process and report outcomes. So in practice, this would probably look like a few check-ins with IHCDA staff throughout the year, probably a virtual Teams meeting to go over any updates on the project. If you have any successes or challenges that you want to report, or if you have any technical assistance needs or questions, that would be the time that we would kind of go over those while the project is in place. At the end of the year, there would be a closeout report required. If you have other continuum of care funding, then this would be pretty similar to what you are already submitting for that. So we would ask for that at the end of the award year. And then there would also be a final report out on outcomes and materials that are developed. So this would probably be another virtual Teams meeting where we would talk about kind of what you learned with the project, what successes you had, if there were challenges, and any materials that you have. If that is something that we can share with the rest of the balance of state, then we would love to do that. So with eligible projects, there are 3 main funding initiatives that we have selected. So the applicant would have to choose one of those 3 project initiatives, and I will get more into that in the next few slides. Another thing that we really want to see from projects is that they are focusing on building up the infrastructure to support these projects, since this funding is not immediately renewable. So this would be available for a shortened award year from May through November, and then the funding would not be immediately renewable to the applicant after that award year is over. And all costs that are proposed in your application would need to be eligible to either be reimbursed through funding or eligible to be used as match. That's not to say that you can't have other activities that support the project, but those are not something that could be used as match or reimbursed from the actual award. So on the left, this is kind of just a demonstration that your budget, it could look like this, where you have your COC award and then 25% match. But in reality, it might be more like you have your COC award, your 20% match, and then you have funding that comes from somewhere else to support those things that aren't eligible under the award, but might be needed to support the project in some other way. So it is okay to have costs like that. They just can't be used as match or claimed for reimbursement under the award. Okay, and now diving into the project initiatives. So there are 3 different initiatives that we would like to see projects address. We ask that you pick one of them, and then you can use any of the bulleted points underneath those that you see in the application kind of as a jumping off point, or you can just pick one of those to stick with, or you could do something completely different. So the first option that we have is related to landlord engagement. So we would really like to see projects that come up with a way of effectively engaging landlords in their region, whether that be coming up with materials that help with outreach or collecting information for landlords that are willing to work with the program, to make it easier to find housing for clients once you have them ready to be placed, or just finding a way to more efficiently communicate with landlords and promote housing programs in your region. You could have a project that does one of those or all of those, or just takes inspiration and does something different. So along with that, I did want to include some different resources and examples that might be helpful if this is the project initiative that you're thinking about applying under. HUD has a housing search assistance toolkit, which I have linked. And I will send out this PowerPoint after this session, and then I'll send out the recording once I have that processed. But there is a HUD housing search assistance toolkit, and they have some great resources in there with kind of outreach materials for landlords. So maybe that's something that you want to look at and take inspiration from, or pull some of those materials and really adapt them to fit the needs that you see in your region better. I also have an example from LA Family Housing. They have a material kind of like what I mentioned before, but I have one of theirs linked where you can see really how they did that. And then I also have a link to the Cincinnati Metropolitan Housing Authority. On their website, they have a calendar of different events coming up. Some of those include biweekly landlord orientations and training. They also have biweekly housing fairs that are free for landlords to attend, where clients can go and meet with landlords and select housing that they like. And they also have some landlord testimonial videos. So those may be some different things that kind of spark ideas, or might be some projects that you want to look at and pull things from. The second initiative that we have is mobile delivery of services. So this could be a lot of different things. This could be making alternative methods or locations for coordinated entry assessments available for survivors in your region. It could be providing services to those survivors that are either still in an unsafe living location, in the process of fleeing, or still trying to find housing on their own. This could also be just providing transportation to shelter, to court dates, to other safe locations, or it could be engaging in mobile outreach, or it could be something completely different that you see a need for in your region. Again, with this, I wanted to provide some resources and examples to existing information and programs that are already out there. The Washington State Coalition Against Domestic Violence has a toolkit about mobile advocacy. That would be a great resource to pull from and kind of look at how they recommend setting up programs. I also have a link to Eve's Place, which is a domestic violence service provider, I think, in Arizona. They have a mobile advocacy program, and on their webpage, they have a couple of recorded webinars where they talk in detail about this program. There is also the National Network to End Domestic Violence. They have a webinar on mobile advocacy. And then there are also a few programs in Indiana that are already doing things like this. So I have a link to St. Jude House and their promotional video talking about the mobile advocacy that they do. And then the third option would be to find and engage a partner that is typically outside of the homeless response system and work with them to decrease barriers that survivors face in the region. This could also look like identifying and conducting outreach in new locations, or using new methods, or building long-term partnerships with partners in your region that survivors are likely to interact with. And with this one, I have some more resources and examples linked. The National Alliance to End Homelessness, they have a toolkit on keeping people and pets together. And there is also the SOAR initiative in Indianapolis, where they kind of pair street outreach and veterinary services and care for people, since that can be a big barrier to people reserving the services that they need if they do have an animal that they don't want to leave behind. I also have some links to some material that kind of talks about the needs of children in domestic violence shelters, or children that have either a parent experiencing a domestic violence situation, or if the child is involved with it as well. There's some material that kind of talks about different initiatives that are happening there. And also one that touches on trauma-informed law enforcement training, since that's another area where survivors are typically, or another area that survivors typically interact with. I also want to highlight our IHCDA Youth Navigators as a resource for this, especially if you are looking at one of the options for engaging outside partners. If you are looking at doing something with youth in your area, these navigators would be a great resource for that, and they have a lot of connections in the field. We don't have a navigator for every region, but for the regions that we do have, they are listed up here. And then Region 11 is kind of split up. And I think Region 12, we are in the process of hiring a new navigator. So if you want to go up here, I have our youth navigator contact page linked, so that will be updated. And you can always check that to see if we have a new youth navigator come on board. So we have this here, and we have their phone number and their email address, and then a region map, so you can find the person that is responsible for your region. Then really quickly, I want to go over how to apply for this funding. So we have our application materials available on the IHCDA public notice webpage. If I can get this to load. Our application has, here it is. So we have the public notice here, and then the application is listed below it. The application starts out and it goes through a lot of the material that I just covered. And it has more information about the different attachments that are required. So if you have questions about where to find something or what you need to include, those should be answered in the application. If they're not, then please feel free to reach out to me over email or give me a call, and I would be happy to talk about that with you. We also have the application timeline here, and I'll go over that a little bit on our next slide as well. And we have the application submission instructions. So your application would have to be submitted to the community services inbox at IHCDA. And we have the email address for that posted in the application. The actual application is in Appendix A of the application packet. So you would go through and fill that out. There are a few eligibility questions, and then a lot of narrative and questions about your budget. In Appendix B, there's the form I was talking about earlier that you can fill out to certify that you have a homeless individual on your board of directors. That would need to be submitted with your application. And then in here, we also have a glossary of some of the terms that come up if you are unfamiliar with them. And the CFR for the different eligible costs that are available under this award. We have that listed for both supportive services and for project administration, if you want an easy way to kind of check that and see what is available when you are working on building your budget for the project. In Appendix E, we have the chart that HUD uses to define homelessness, where it goes through each category of homelessness and their definition for that. And then in Appendix F, there are some additional terms and conditions, which are items that you would see in your contract if you are awarded this funding. So to apply, you would need to fill out that application. There is also a project description, which should be no more than 2 pages. We also ask for a copy of any region-specific CE policies for DV survivors. Then certification. So that would be a print screen of your SAM.gov registration and for your Indiana Secretary of State registration. The homeless representation form, an IRS 501c3 determination letter, letters of support from any partners that you're working with, match commitment letter, and then if you are doing in-kind services as match, then we would want to see an MOU for that. This checklist is also included in the project application, so before submitting, you would need to go through and make sure that you have all of these materials available. And if there are any materials that you have questions about, please reach out and I would be happy to answer any questions that you have. And then lastly, I want to go over the timeline for this award. So this was released on March 8th, and then the application is due to IHCDA on March 31st by 5 p.m. From there, we will review those applications and we will make a tentative selection for the board to approve on April 7th. Then we will take it to the board and present it, and we'll get final approval on those projects on April 27th. And then on May 1st, the awards would begin. And then I don't have this on here, but again, November 30th would be the end date for the funding. So you would have 7 months from when the project starts to when it ends to spend that funding and implement your project. Okay, that's all I have. So I want to go ahead and make sure that we have some time for questions. So I will go ahead and open up the floor. Okay, if we don't have any questions, I am available by email or by phone. Please feel free to reach out to me. I would be happy to chat privately if you have a question that you don't want to kind of ask in front of the group. But if there's anything that you need, or if you want help kind of coming up with a project budget or anything like that, please feel free to reach out. Like I said, I will try and get this recording out later this week, and I will send out the slides once we end our meeting. So if nobody has any questions, I will go ahead and end the recording and give you back a little bit of time in your day.